Healthcare costs are rising, and waiting lists are getting longer. Every year, millions of people travel abroad seeking medical treatments, some for affordability, others for access to procedures not available in their home countries. Countries like India, Thailand, Mexico, and Turkey have become major destinations, offering everything from life-saving heart surgeries to cosmetic enhancements at a fraction of the cost. But while the promise of world-class treatment at lower prices is tempting, the reality isn't always straightforward. What happens if something goes wrong? What legal rights do patients have in a foreign country? And how does medical tourism impact the local healthcare system? Today, we're breaking down the pros, the cons, and the legal complexities of medical tourism so you can decide whether it's an opportunity worth taking or a risk too big to ignore. Every great journey needs strong support. Thank you, M3 Global Research, for being our valued brand sponsor. Medical tourism, is it really worth the hype? Let's explore the benefits. One of the biggest reasons people travel for medical treatment is cost. Healthcare in countries like the US and UK can be expensive, while nations like India, Thailand, and Mexico offer the same procedures at a fraction of the price. For example, a heart bypass surgery that costs $100,000 in the US may be performed for just $10,000 in India. The difference? Lower labor costs, fewer administrative expenses, and different insurance structures. This makes quality healthcare more accessible to those who may not afford it otherwise. A common misconception is that lower cost means lower quality. In reality, many medical tourism destinations have internationally accredited hospitals and highly skilled doctors. Facilities like Bumrungrad International Hospital in Thailand and Apollo hospitals in India adhere to global healthcare standards and employ doctors trained in the US, UK, and Europe. Many hospitals are Joint Commission International (JCI) accredited, ensuring that medical tourists receive the same level of care they would at home. Long waiting lists are a major issue in public healthcare systems. In countries like Canada and the UK, patients may wait months or even years for non-urgent surgeries. Medical tourism allows patients to skip the queue and receive treatment without delay, making it an attractive option for those in need of urgent medical attention. Certain treatments, such as stem cell therapy, fertility procedures, or experimental cancer treatments, may be restricted in some countries due to regulations. Medical tourism provides an opportunity for patients to access innovative treatments that may not be available in their home country. For patients undergoing cosmetic surgery, gender reassignment, or fertility treatments, privacy is a key concern. Traveling abroad allows them to undergo procedures without social stigma or unwanted attention, making medical tourism a preferred choice for sensitive treatments. Let's take a moment to talk about our brand sponsor today, M3 Global Research. M3 Global Research, founded in 2006 by M3 Inc., connects medical professionals worldwide with valuable paid research opportunities, setting the gold standard in healthcare market research. Why should you join M3 Global Research? Get a $30 welcome bonus per panel, select specialties, adjusted for local currency. Register for both M3GR and AGC, and earn up to $60. Get invitations to participate in research that shapes the future of healthcare while earning extra income. Invite colleagues and earn more. Your data is fully protected at all times. Get started today. Have your ID and medical license handy for quick verification and start earning. Register now and become an M3 Global Research member in 10 minutes by following the 5 registration steps. Join over 2 million healthcare professionals worldwide to impact key developments and decisions in the healthcare industry. Have your identity card and, where relevant, your medical license at hand to go through the verification process quicker. Your data and privacy are protected at all times. The hidden risks of medical tourism. What should you watch out for? Examining the downsides. While many international hospitals maintain high standards, others may lack proper accreditation, have poorly trained staff, or operate under weak regulations. This increases the risk of infections due to poor hygiene, surgical errors caused by inadequate training, misdiagnosis and improper treatments, the use of counterfeit or substandard medications. Without thorough research, patients may unknowingly place their health at risk. One of the biggest concerns in medical tourism is continuity of care. What happens if complications arise after surgery? Patients returning home may struggle to find doctors willing to take over their treatment, as many are unfamiliar with foreign surgical techniques. Some local doctors may even refuse to treat medical tourists due to liability concerns. This lack of follow-up care can lead to serious complications, delayed treatment, and additional medical costs. If a medical procedure abroad results in negligence or malpractice, legal recourse is often limited or non-existent. Here's why. Most malpractice laws apply only in the country where the procedure was performed. Filing a lawsuit in a foreign country can be expensive and complex. Even if a court rules in favor of the patient, enforcing the decision across borders is challenging. Many patients are unaware that the legal protections they enjoy at home may not extend to foreign medical providers. Some medical tourism practices raise serious ethical dilemmas, particularly in organ transplantation. Reports of illegal organ trafficking have emerged in some countries, where vulnerable individuals are coerced into selling their organs to meet international demand. This raises a difficult question. Should affordability and convenience come at the cost of human rights? While medical tourism boosts local economies, it can also widen healthcare inequalities. Private hospitals may prioritize international patients who can pay more, while local citizens struggle to access the same quality of care. This diverts resources away from local communities, creating healthcare disparities in developing nations. Legal and regulatory challenges. Are you legally protected when seeking treatment abroad? Navigating the legal landscape. Medical malpractice laws vary between countries. If a patient suffers negligence abroad, they must file a lawsuit in that country, which is often costly and impractical. Many medical tourists are unaware of this legal barrier until complications arise. Unlike aviation or pharmaceuticals, medical tourism lacks uniform global standards. Each country has different accreditation systems, regulatory bodies, and malpractice laws, making it difficult for patients to assess hospital reliability. Many health insurance policies do not cover treatments abroad, leaving patients to bear the full cost. Even medical travel insurance often provides limited coverage and may not protect against post-operative complications. Additionally, some foreign hospitals require patients to sign liability waivers, reducing their ability to sue in case of malpractice. Some countries require medical visas for treatment, which can complicate travel plans. If a patient experiences post-operative complications and needs to extend their stay, they may face legal and financial difficulties due to visa restrictions. As we reach the conclusion, it's evident that medical tourism offers significant advantages, from affordability and accessibility to specialized treatments. However, it is not without risks. Health complications, legal barriers, and ethical concerns make it essential for patients to thoroughly research their options before seeking treatment abroad. For those considering medical travel, here's what matters most. Verify hospital accreditations and surgeon credentials. Consult with local and international medical professionals. Understand legal risks and lack of legal protection. Ensure a post-operative care plan before returning home. While medical tourism presents an opportunity for affordable and quality healthcare, it should never come at the cost of safety, ethics, or legal security. Before making a decision, weigh the pros and cons carefully, because when it comes to your health, cutting corners can have long-term consequences. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more valuable insights on appraisals, revalidation, and interesting topics in healthcare. Every great journey needs strong support. Thank you, M3 Global Research, for being our valued brand sponsor.